Hello, I'm Muhammad Akmal Ashraf and this is Nursing Care Plan. The first nursing diagnosis is altered nutrition, less than body requirements, as evidenced by decreased intake of foods and beverages. The first nursing intervention is to monitor our patient's food intake, and this is to identify the patient's nutritional strength and deficiencies. The second intervention is we should administer antiemetics as prescribed to reduce nausea and vomiting. Then we have to identify anticipatory nausea and vomiting. Psychogenic nausea and vomiting usually occurs before chemotherapy and the patient does not respond to antiemetic drugs. Hence, a change of treatment environment may be required. The fourth intervention is we should provide a proper environment for eating. This can help reduce stress and increase appetite for our patient. We should also ensure that the patient has a good oral hygiene, which can have positive effects on appetite and the taste of foods. Fatigue is a side effect of chemotherapy. Hence, we should provide rest before meals, cut food into smaller pieces, and the patient may require help to complete a meal. After 30 minutes of intervention, the patient should show no sign of malnutrition, maintains weight within normal lab values, and participate in specific intervention to stimulate and increase dietary intake. The second nursing diagnosis for our patient is the risk for fluid volume deficit, which is caused by nausea and vomiting due to side effects of chemotherapy. The first nursing intervention is we should monitor vital signs and assess for capillary refill time. According to Reed, Bailey and Salon 2018, increase in capillary refill time indicates dehydration and decreased peripheral perfusion. Then we should assess for skin turgor, mucous membrane, and complaints of thirst, which indicates hydration status and degree of deficit. The third nursing intervention is to administer IV fluid as indicated, which can provide general dehydration and reduce the side effects such as nausea and vomiting. The fourth nursing intervention is we should auscultate and report for abnormal heart sounds. According to Wayne 2016, cardiac alterations such as dysrhythmias may indicate hypovolemia and or electrolyte imbalance. Then we should increase fluid intake to at least 3,000 ml per day as tolerated by patient. This is to assist in maintenance of fluid requirements. The sixth nursing intervention is we should ensure the patient is on a strict intake output charting. Continued negative fluid balance, decreased renal output, and increased concentration of urine suggest dehydration. After 30 minutes of intervention, the patient should display adequate fluid balance as evidenced by stable vital signs, moist mucous membranes, good skin turgor, and adequate urine output.